Hello everyone, you're watching sqadia.com and I am Dr. Hammad Haider. Today, our topic is systemic disorders associated with osteonecrosis. We have dealt with this topic before as well, and we have mainly gone through the traumatic causes. But what about the atraumatic causes? In this lecture, we'll be going through the non-traumatic or atraumatic causes which cause osteonecrosis. We'll be going through certain systemic disorders such as sickle cell disease. What is its epidemiology? Why the cells actually become sickle shaped, especially RBCs when they encounter hypoxic conditions? And what are the different imaging and management of sickle cell crisis and sickle cell trait in patients with sickle cell anemia? Then we'll be going another important cause, which is the Caisson disease, which is especially the disease of the divers, those who are working on the deep sea areas, especially under very high amount of pressures. They may develop some osteonecrosis of different parts of the bones due to kind of nitrogen imbalance, because once they rise about towards the surface, there's actually excessive amount of nitrogen gas which gets collected in the adipose tissue as well as in different arterioles as well, and where they may causing an embolic type of a phenomena leading to AVN. We'll be going through the Gaucher disease and radiation necrosis. As we know that Gaucher is one of the metabolic disorders, but due to enzymatic deficiency, this results in a specific type of cells called as Gaucher cells, and this due to as bone marrow is unable to produce normal hematopoietic cells, this may lead to certain avascular necrosis of certain parts of the bone. Then lastly, we'll be going through the osteochondritis dissecans. It usually affects the joints such as elbow and knee, and we'll be briefly going about its pathogenesis, its clinical representation, and what is its treatment. And last, it would be the bone marrow edema syndrome. Although it's a very rare syndrome, but maybe just due to bone marrow edema, when where actually the most of the blood supply from the to the bone is through the end osteola, through the medullary canal. If bone marrow is edematous, this may be due to decreased blood supply, which is going to the cortical regions of the bone, which may result in avascular necrosis of certain parts of the bone. Thank you very much. Keep watching sqadia.com.